Well, good morning, everyone. And first of all, let me express great gratitude to Singapore for hosting this very important meeting. But let me please address some of our dignitaries here. Dr. Amy Khor, Senior Minister of State, Ministry of Health and Ministry of Environment and Water Resources. Professor Chuan Tang, a good friend, Chief Health Scientist, Executive Director, Office of Healthcare Transformation, Ministry of Health, Singapore. Mr. Fu Hua Xi, Chairman of the National University of Health System Board and the Board of Trustees, National University of Singapore. Professor En Chai Tang, President of National University of Singapore. Professor Kei Guan Yew, Chief Executive, National University Health System and Senior Vice President, National University of Singapore. Dr. Wei Yang Cheng, Deputy Chief Executive Officer, National Research Foundation, Singapore. And of course, last but not the least, Professor John Wong, the co-chair of our Global Roadmap for Health Longevity Commission, National Academy of Medicine, and Senior Vice President, Health Innovation and Translation, National University of Singapore. First, let me say that for me, this is home. Many of you know I'm an honorary citizen of Singapore, and I'm very proud of this. I'm wearing my pin today. Thank you. And the fact that Singapore is a model country in so many different ways in health and healthcare. Certainly in its healthcare system, also in its public health, as you heard, and of course now plan for community aging. We're so glad to be here. I also want to make sure I thank John Beard and Sharon Inouye for organizing this meeting, Dr. Linda Fried for the co-chair of the roadmap, and of course for all of you for being here. I know it was kind of, as John said, touch and go, but the fact that nobody actually suggests canceling the meeting and everybody's here goes to show your commitment to this very important area and your faith and confidence in the Singapore public health system. By the way, the hero of SARS, Chuan Tang, is here, so we know in good company. Okay, so I also, of course, want to thank Dr. Cecilia Shah and her team for doing an outstanding job. So my job is to tell you what this roadmap's all about. And I thought what I'll do is, for those of you who do not know that much about the U.S. National Academy of Medicine, to show you 2 slides, just to tell you who we are and why we're in this space. And then I will tell you more about the purpose of this roadmap, and particularly the purpose of this workshop. So we are the U.S. National Academy of Medicine, and our founding organization is the U.S. Academy of Sciences, founded in 1863, chartered by Abraham Lincoln and Congress as an independent, non-government organization that advised, at that time, the U.S. government, particularly during Civil War, on issues of science and art. Over 150 years, we have continued to play a critical role as advisors to U.S. and, of course, now increasingly globally. We're independent, and our reports are evidence-based. In 1970, the Institute of Medicine was founded as part of the National Academy of Science, and it continued its function. And then in 2015, we reconstituted as the National Academy of Medicine, and now we have 3 national academies in the United States: Science, Engineering, and Medicine. As you can see, our work cuts across so many different areas in health and medicine and affects people worldwide in addition to US. Here are some examples of the previous reports that's been generated by the national academies in health and medicine. Many of you know that the report in 1999 to Air is Human really launched the entire global movement in patient safety. We have certainly called attention to the AIDS epidemic and, of course, influenced the reauthorization of PEPFAR, which is, as you know, a large commitment of the United States to AIDS globally. In 1988, we're the first to say that we should sequence the human genome At the time, even geneticists thought this is a crazy idea, didn't have technology, too much information, not possible. We coined the term precision medicine that opens up, of course, today the promise of this area in medicine in the future. In 2017, we were the first to actually have a report on human genome editing, which, as you know, is another international commission that I have commissioned along with my colleague Marcia McNutt, the National Academy of Science, and the Royal Society to have a second report to really update the issue of human genome editing. As mentioned by Professor Wong about our global infectious disease risk framework report in 2016, and I saw Peter Piot somewhere in the audience, and of course Peter was central and pivotal in also really leading many, many changes in this area of pandemics. And of course, we're also the organization that writes the U.S. dietary guidelines. These are some examples that we do, and if you look carefully at these reports, they're not really only targeted U.S. Audience, but in fact, they're global audience. Importantly, I want to tell you why this international commission, and I want to emphasize the commission is truly international. Although we convene, this is in fact the work of people all over the world. Our report is meant to impact globally and not just only US. So why? You already heard Dr. Amy Cole pointed out that by 2050, there will be a doubling of people globally over 65, possibly about 20% of global population. But what's also of concern is the fact that the number of young people under age 5 is shrinking. And in fact, in 2050, 6% of global population will be under age 5. If you look at the slide on the left-hand panel, it's reflective not only of aging population, of a decline in fertility rate. So that the slide on the right side, upper right side, shows you dramatically what's happening even as we speak. Because if you follow the slide closely, 2020 when the two curves intersect, so that even as we speak, there are more people like me over 65 than those like my grandchildren less than 5. This is of great concern, of course, in this population shift, epidemiologic shift. At the bottom of the slide shows you, in fact, what they're known as the population pyramid. And what you can see clearly is that in 1970, there's a much larger base of people of the younger population, and increasingly this is shrinking, and in some countries, like Japan, it's almost a rectangle at this point. And I think we predict an inversion of this pyramid over the next number of years. So the implication, of course, of the population aging fundamentally impacts families, communities, societies, industry, and economies. As shown in this slide, we all know that NCDs are 4 to 5 times higher in the older population, given cancer, cardiovascular disease, mental health, many others. And this puts a tremendous demand on our health and healthcare systems, which obviously affects the number 2, which is, are we prepared to deliver the right kind of care as the population is aging? It puts another demand on the financing of the health system. And we all recognize the family structure as we live, as I look back at my younger days, because these days with nuclear families and much fewer younger people, we're fundamentally changing the family relationship and structure. And of course, social infrastructure, which will be discussed today. And importantly, the social insurance and retirement programs. And here I have to give a shout out to Singapore for its very progressive way of looking at this particular issue. And all of us know that this has great, profound impact on our workforce, an aging workforce with much fewer younger people to fill the openings and the voids. Now, so the question, as was asked earlier, is are we prepared? Overall, if you look at the studies globally, such as CSIS Global Aging Preparedness Index or Help Age International Global Aging Watch Index, I think you can comfortably say that very few countries have made significant progress in reducing the magnitude of old age-dependent burdens. Many countries do well in one dimension, actually does not do well in the other dimensions. So while some countries and government, like Singapore, have begun to act and starting plan for long-term, too many have not. So our message is that preparing financially, socially, and scientifically for longer lifespan is a global imperative, and hence the International Commission. Now, there is, of course, as Minister Kaur said, many upsides. I certainly feel it every day, right? Older people are wiser, I think I am, and happier most of the time, and certainly more experienced. And so we can contribute enormously to society if we can remain healthy, hence the idea of healthy longevity and its dividend. How do you realize it is the fundamental issue. We need to mitigate the challenges and potential burdens posed by global aging, and it will require broad, systematic change and deliberate action across multiple domains. And I've listed only some of them on the slide. Basic translational research and innovation, clinical medicine and healthcare, personal, social, economic, and environmental determinants, and policy and financing. And this is not a complete list. But I think we all agree there's a need for comprehensive and global assessment of the challenges facing the aging population and finding the right solutions and directions required to improve health, productivity, and quality of life. So this is why the National Academy of Medicine took this on. When I became the president in 2014, I asked my council and our members, should we have a grand challenge? And what is our grand challenge? Believe it or not, overwhelmingly, aging was selected. So we decided to have only one grand challenge because we want to focus our effort in looking at whether we can actually make a difference. So in grand challenge is to inspire the nation and globally to coalesce around a shared priorities and audacious goals for addressing the big challenges and opportunities in science and medicine. And of course, we want to inspire action at different levels. So I'm very pleased to tell you that we have seen the response of the community, public and private. And the aim of the Grand Challenge is to comprehensively address the challenges and opportunities, to address social, economic, political, and other environmental factors, to catalyze breakthrough ideas and research that would extend the human health span, not only lifespan, and generate transformative and scalable innovations worldwide and build a dynamic network for support for health longevity that encompasses healthcare, social factors, economics, research, innovation, industry, policy, community, and beyond. So we launched the Grand Challenge last fall. In October, the Grand Challenge was launched, and there are two components to this. One, as you can see on the right side, is a global competition. And thank Singapore, particularly Chua Chuan Tang and others, and NRF, to supporting this Grand Challenge. You heard from the minister that, in fact, just this month, we have actually announced the Catalyst Award. So some 49 countries and territories have joined this Grand Challenge, Singapore being one of the leaders, as is China, Japan, UK, European Union, United States, and elsewhere. And we're giving out $50,000 Catalyst seed grants for novel creative ideas. This is supported by the AFA, which is the Association for Aging Research, United States. And we are going to look at the success of this creative ideas in any field. And then those which are successful, or at least have promised, will get the next level of support called Accelerator Award and eventually a grand prize. What I'm here to talk about today is on the left side of the slide, which is the roadmap. So the grand challenge of these two components, competition and roadmap. The roadmap is to get the comprehensive assessment, as we talked about, and look for promising solutions. So It is structured as an international commission to look at these issues and to assess the evidence across 3 domains: social, behavioral, environmental enablers, healthcare systems and public health, and science and technology, with the idea that all these domains will look at cross-cutting themes that include policy and practice, health equity and disparities, innovation, financing, and monitoring and metrics. The Commission will produce a roadmap with actionable recommendations to guide stakeholders in devising integrated systems-based approaches. Our intention is the roadmap will provide the thinking behind this so that all countries can use the roadmap to contextualize, particularly in their country, what they're doing and how they can move this issue forward. We're very, very pleased that we have indeed an International Commission co-chaired by John Wong and Linda Fried. But I would say that if you look at the 17 members, they cover 10 countries and 6 continents, with expertise from Africa, from South America, from Japan, from Singapore, from United States, from UK, and many others. We're so pleased, in fact, have the expertise of this group, who's going to work for over a year in creating this report, and they will be supported by this approach. First, in moving towards this commission, we had a planning committee that, in fact, both Linda Fried and John Wong were a part of. So in launching this whole initiative is being overseen by an international oversight board, which is, in fact, chaired by myself, co-chaired by John Jenkins of AARP United States, but has Cho Chuan Tang, Marian Dzau, and Keiso Takemi, who's also a co-chair on this particular oversight board. Their job is to oversee the integrity of the process, appoint the statement of task and the commission, and to overall guide the production of this commission. You see in the middle the International Commission, where I've already introduced the group. It is to write a definitive report in this area, independent and evidence-based. It's fed in by 3 work streams, as you can see towards the bottom. Each one is conducted with a workshop, such as we have today. First is social, behavioral, environmental enablers, which is held in Washington in November. The middle one, which is why we're here today, is healthcare systems and public health work stream, which is a 2-day workshop in Singapore, convening all the experts in this area to discuss this. And the third one will be in Japan on science and innovation. What are the technology investment we need to have in the future in order to support healthy aging, healthy longevity? As I mentioned, you can see in the bottom, all these workshops will look at cross-cutting themes on policy practice, equity, innovation, financing, and metrics. When we're done with this initiative, we'd have, just like the Global Health Risk Framework, would have consulted over 200 to 300 experts globally through workshops, consultations, and many other mechanisms. And so this is why you're here today. Today's workshop goal is to look at the entire spectrum of norms, institutions, and systems that provide health and social-related services. The workshop will discuss existing evidence for an entire system of healthcare, health promotion, and preventive services for aging population, identify potential for innovative new approaches. Critical challenges and gaps in the current workforce, key success and failures of policies and programs, health financing and policy tools to guide effective multi-sectoral solutions and actions, potential for new data approaches, health information tools and innovations, and last but not the least, effective mechanism for stimulating meaningful collaboration among relevant stakeholders across sectors and disciplines. So I just want to tell you my gratitude to all of you for being here. And of course, I know that this is going to be a most productive meeting. I know we're going to learn a lot from each other. I know we're all building the future for healthy longevity. Thank you very much indeed.